Hey, Robin, how's it going?
Oh, Sean, I'm feeling really frustrated. I have a couple of students who are clearly struggling, and I wish I knew how to help.
Tell me more. Maybe there's something we can do.
I don't want to name names, but one kid's parents are getting divorced, and it's clearly causing issues. She also tells me that her friend is being bullied and doesn't want to come to school anymore. What should I do?
During a mental health crisis, such as stress or anxiety, issues with peers or family, depression, bullying, relationship problems, thoughts of suicide, or other issues, help is available. If you are working with a youth who's in crisis, the iMatter program provides free telehealth therapy sessions for youth aged 18 or under. After a youth signs up, they can typically start a session with a therapist quickly. Learn more at the iMatter website. You can also refer youth to a school counselor or encourage them to reach out to the 988 Colorado Mental Health Line. They can call or text 988 or live chat on 988colorado.com. You can also call 988 and request to have a mobile crisis response team come to your location and assess the youth on the spot. And don't worry, we'll provide a list of all the online resources we talk about here at the end of the video. There are also several walk-in centers across the state for those who prefer in-person support. For more information about walk-in centers, visit 988colorado.com. Walk-in centers and 988 Colorado services are free and are provided by trained specialists who will listen without judgment and help determine the next steps for intervention. And remember, you should always dial 911 immediately if someone is about to hurt themselves or others. To learn more about these crisis-related services, review the video Encouraging Young Adult Youth Advocates to Learn About the 988 Colorado Mental Health Line. If it seems appropriate, you can also recommend that youth advocates and other students review the video Start Here, Getting Help from the 988 Colorado Mental Health Line.
Well, these all seem like crisis services. I don't know that both of these kids have that level of urgency.
We talked about some great resources for people in crisis, but what options are available to somebody who's not in crisis but experiencing emerging or ongoing mental health challenges? There are lots of ways to get help, starting by looking at what's available close by. For youth in high school, a school counselor or other trusted adult can help them explore avenues for treatment. For college students, there's likely a counseling center or campus health center that offers mental health support. In fact, if a school receives federal funding for mental health care, they're obligated to provide these services. Most school websites have information about how students can get help. To find mental health care outside of a school setting, you can use the Colorado Lifts website. It features a search tool that lets you filter by accepted insurance providers, location, and other factors. Colorado Lifts can also connect individuals to a care navigator who can help them find the services that they need. Youth can use Colorado Lifts services even if they don't have insurance. And you can assure youth that it's safe to contact Colorado Lifts. They'll never share personal information with others. Note that these services are not just for youth. If a parent or caregiver asks for help for themselves or others, you should share this information with them too. Encourage the youth to discuss any mental health-related issues with a trusted adult, such as a parent or caregiver, if possible. If circumstances make it challenging or don't allow the youth to discuss treatment needs with a parent or caregiver, they can access services on their own if they're 12 years of age or older. The Colorado Lifts website is a great place for youth to look for services. If possible, encourage them to ask a parent or caregiver about your health insurance coverage to determine which providers in their area are covered by their plan. You or the youth can also search for in-network providers on the health insurer's website. If they don't currently have health insurance coverage, you can help them locate a community mental health center at the Behavioral Health Administration's website. These organizations may provide services at no or reduced cost. The iMatter program also provides free telehealth services for youth. The youth or parent can sign up for these sessions on the iMatter website. These organizations may also accept Health First Colorado coverage, which is Colorado's Medicaid program for no-cost care. Provide the youth with an overview of what they can expect when they get treatment. And be sure to mention that their actual experience when seeking help may differ in some ways based on their needs. After they find a provider, during their first appointment, they'll answer questions to help the provider learn more about what they're going through and determine what type of care will help. This is called an assessment. Then they'll develop a plan of care. Therapy may be available in person or by telehealth. The therapist may also recommend additional support services if needed. To wrap up, remember, you can help youth advocates and students navigate the Colorado mental health system. And youth don't need to be in crisis to get the mental health support they need. Take a moment to explore the services we covered in this video.